This episode of Common Health is brought to you by Reg Lantern. Reg Lantern is a straightforward and easily understandable software platform built to assist community health centers in staying compliant so they can focus on serving their patients rather than paperwork. For health centers that are serious about achieving, managing, and maintaining compliance, Reg Lantern provides a comprehensive approach and is an affordable and valuable solution. Reg Lantern can help your health center. Contact them today at reglantern.com. That's REG, as in regulations, lantern.com. For special discounts, mention that you heard about Reg Lantern on the Common Health podcast.
Hello, and welcome to Common Health from the Virginia Community Healthcare Association, or VCHA, or what we're also known as is VCHA. On Common Health, we're amplifying the voices of community health, both those who give care and those who need it. We are so happy you are back with us today to listen to this next podcast here on Common Health. And as always, and as you know, listeners, I always am very thrilled with the speakers or the guests that we have on the show. We always try and make sure we bring dynamic folks to you so that you can learn more about some of the fantastic Virginians and their lives and the impact really on healthcare as well as other things that we have brought to you all in our episodes. Today we have I have to say, this is actually a friend of community health centers. And although he comes to us from Virginia, I would say that he really is a friend to all community health centers. And, you know, he does do a lot of work here in the Commonwealth of Virginia. But again, a lot of what he does really does spread around to not just community health centers, but to communities and also as a way to keep communities healthy. Today, listeners, we have, I'm going to refer to him as Representative Otto Wachsmann. Otto Wachsmann is a proven fighter and community leader who has really dedicated his career to serving Southside Virginia families and communities. As a father and a pharmacist, yes, he's a pharmacist, an experienced business owner. Yes, he's an entrepreneur. Otto fights for rural Virginia and helps to improve their communities for future generations. He grew up in Sussex County, Virginia, where he has spent his childhood working at his family's pharmacy in Stony Creek and summers working on his grandfather's farm. Otto attended the College of William and Mary for 2 years, and he's earned his Bachelor of Science degree in pharmacy from the VCU, Virginia Commonwealth University School of Pharmacy. He was elected to the Virginia House of Delegates from the 75th District in November of 2021 and assumed the office on January 1st, 2022. And with that, I do want to say welcome, Otto, and thanks so much for joining us today.
Well, thank you for that welcome, Tracy. I really do appreciate it. Listening to it, your focus on me being a community-minded person, particularly in rural Southside Virginia, that really is what I've dedicated most of my life to. I really believe that healthcare issues in rural areas are ones that have been often overlooked. As a pharmacist, I did own Stony Creek Pharmacy for about 18 years. I was very pleased to start working in it when I was 7 years old. My father bought the store when I was about a year old. I started working there when I was 7. Worked for a lot of community pharmacies in the district at one time, and just thoroughly enjoy being in a community pharmacy and helping the people in this part of the state. I'm just so pleased that I've got the ability to continue helping people. As I imagine we'll probably talk about in the future, there was a lot of the reimbursement issues that unfortunately caused me to step away from the dream job that I had of owning a pharmacy in a small town and having that impact on the community. But thank you so much for inviting me here today.
Absolutely. And Otto, we are going to touch on you and the pharmacy that you owned and some of the reasons why you chose to go down the road that you chose as far as your career, as well as running for public office. But before I do that, I do want to talk about, where you're from. You are a pharmacist by training, but yet you chose to go back to your community after you got yourself educated. Why? Why did you do that? You could have gone to some of the big cities out there, but yet you chose not to. So why did you go back to rural Virginia?
I did briefly step away a couple of times. I had the opportunity when the A.H. Robbins Company was going Chapter 11. Some may recall that was a rather large pharmaceutical company. I believe it was in the Fortune 500. It was based out of Richmond. At the time, I was doing a lot of work for the Virginia Pharmacist Association, particularly in third-party reimbursement. They wanted to have a presence in managed care. So I think it was April Fool's Day of 1988 or 1989. On April the 1st, I took a job with a Chapter 11 company, and I was their first manager of managed healthcare. I lived in Richmond and worked for them for about a year, had an eye-opening experience to how pharmaceuticals are priced, different third-party contracts, the rebating process. I was their manager of managed healthcare, technical information, and at one time, I was also their manager of new product planning. So for that year living in Richmond, I really got a behind-the-scenes look at how the pharmaceutical industry priced products, brought products to market, that type of nature. And then I also went to Winchester for about 7 years. My wife and I worked at Shenandoah University. They started a pharmacy school up there, and while I was there, I picked up my Doctor of Pharmacy degree as well. I was responsible for sending our students to 6 and 7 different rotations their final year in pharmacy school. Through that, I got a lot of different exposure to another side of pharmacy practice too. Some of them, the third parties where we sent students to, and that was really a marvelous opportunity. But my heart has always been in Stony Creek in Southside Virginia. When we moved up there for 7 years, I kept the house that I had on my grandfather's farm, knowing I would move back. Once that program got up and running, my father was looking to retire, and I quite honestly jumped at the chance to come back to Stony Creek to serve those people that I have served for so long. And quite honestly, that to me, that's what life is about.
I love it. And you've had an interesting, just like when you went through as far as a trajectory, as far as your career is concerned, why pharmacy? And then you run for public office.
Why pharmacy? It's interesting. When I was growing up, I loved being on my grandfather's farm so much. Originally, I wanted to be a farmer. And when I was about 6 or 7 years old, my grandfather owned, I think, the most Nottoway riverfront property for his farm in Sussex County, but it was on the wrong side of the river. It was on the low side of the river. And it flooded one time, and he took me in his truck down to our low ground fields, and we sort of watched our crops kind of float on off into the river. And my grandfather asked me again what I wanted to be, and I kind of went, I get to travel with my dad to those shows when he does his annual buying for the Christmas holidays. And I meet all these other pharmacists, and they're so excited. They're so full of excitement. They love what they're doing. Maybe pharmacy is not such a bad thing after all. So, and I've never regretted that decision for the longest time. That really, to be able to have people come into the pharmacy and help them. For so long, we did not have a doctor's office in town. When my father first bought the store, there was one in town, but a couple of years later, that doctor moved his practice to Emporia, which was about 20 miles away. And that was a period for probably 15 years. We were the only group in town for healthcare. The next nearest other pharmacy, for the most part now, is 20 miles away. The hospitals are 20 miles away. We've got one in the north and one in the south. That's where the doctor's offices are too. The next nearest doctor's office at the time was 20 miles away. My father was also mayor of the town of Stony Creek, kind of part of where I got my legislative desire from. When I was getting out of pharmacy school, he led a campaign to get a rural healthcare clinic in Stony Creek. And he was successful. That Stony Creek Community Health Center started in Stony Creek mid to late 80s. It is a federally qualified healthcare center. And that came into play later on, about 5 years before I sold my store. The reimbursements for community pharmacies in rural areas were at the point where they were of diminishing return, and we knew that the writing was on the wall for profitability. So we started working a little bit more with Stony Creek Community Health Center, convinced them to let's step into the role of 340B pharmacy as a contract pharmacy. And that really helped me hang on to that store for about 5 more years until ultimately ended up selling it to the community center.
Awesome. And I would be remiss if I did not speak to you making the decision to run for public office. Why? Why run for public office?
I mentioned my father was mayor. Also mentioned when I was at Shenandoah, I was responsible for rotations for those pharmacy students. When I was in pharmacy school at MCV in '86, I did a legislative rotation with Harvey Morgan. Delegate Morgan was a delegate from the Gloucester area, pharmacist, a mentor of mine. I got to work with him for a month during that rotation and see the impact that legislators can have on helping people. What really drove me at Stony Creek Pharmacy was being able to help the customers. Quite honestly, as those reimbursements I was talking about from insurance companies declined so quickly, I realized that I no longer would be able to serve that role. It was very frustrating to know what I needed to do for patients to help them, but not having the resources to do that. And I sort of looked at the legislature as now I can have a positive impact and help some of those people. Like, it was such a real pleasure when I met you, November, not that long ago, at the Little Pino's Italian restaurant in Waverly. Yeah. And we sat down and you were talking about the issues that the Virginia Community Healthcare Association was having, particularly with the 340B issue. And that's an issue that I had quite a knowledge about. So certainly I saw the need to help your organization with that. And I think that's been a win-win, I hope.
I agree. And listeners, if I could just share with you, when I tell you that Otto is a friend of not just the association and Common Health, but really of community health centers and of communities and really keeping everyone healthy. We were very fortunate that we had a bill that was put forward before the legislature, as well as signed by our governor. But it was Otto that made the decision to patron that bill. And he stood behind it and he fought for that bill. And that bill really is to help community health centers in a way that they can continue to make the investments that they make in their patient population when it comes to the services that they provide. And it helps put protections around their pharmacy programs. And when Otto tells you that he is committed to the communities and keeping them healthy, he stands behind that. And we can certainly say that when it comes to the work that he did around getting that bill pushed through. And so with that, Otto, one of the things that we have brought to our listeners is we've really exposed them in a variety of ways in community health, right? What is community health? What is our primary focus with community health centers, as well as other providers in the public health setting? And we've talked a little bit with our audience around pharmacy services and what we call 340B. And you had talked about you owning your pharmacy and that you ended up becoming a contracted pharmacy with one of our community health centers here in Virginia. But can you just talk just real briefly in layman's terms, right? What is this 340B pharmacy program? Okay, from a pharmacist perspective. And then how does it help our listeners, right? Can you just speak to that real briefly?
Well, sure. Well, the 340B program is a federal program that has the pharmaceutical manufacturers, often they're criticized for having extremely high drug prices, which drug prices are high without a doubt. But the federal government was looking for a way to fund some of these federally qualified healthcare centers and rural healthcare centers in parts of the state where there wasn't enough population density to make it viable for a health center to go at. This was, 30, 40 years ago. And that happened about the same time that the manufacturers were being criticized for having very expensive drug prices. But the federal government got together with the manufacturers to help fund these covered entities, those rural healthcare clinics and federally qualified healthcare centers, by offering them deep discounts on their prescription drug prices. In turn, those centers can use those deep discounts as a profit center to help fund those services that they need to be able to serve in the community. And I'm told some of those centers will use some of those savings to hire additional medical staff, maybe a new nurse practitioner, maybe a doctor's salary. There's one community health center I know around here that says that they use those funds to help fund their behavioral health program because those programs are profitable the way that the third-party payers are. That's basically in a nutshell what those 340B discounts do. It's a way for community health centers. It also includes hospitals, too, as another side. Those hospitals, what they're saying in disproportionately shared areas, say a facility that may be a hospital in a very low economic area that they know a high percentage of their patients can't afford to pay their bills. So the hospitals will use the profits off those extra discounts to help cover those costs. That's basically what the 340B is. It's administered through HRSA, which is a federal program under CMS, I believe. And particularly, HRSA has a department called OPA, the Office of Pharmacy Affairs, that you apply to become a covered entity to be eligible for these discounts.
And Otto, why was it important for you to support and patron a bill to protect these discounts that community health centers realize through the 340B program?
Well, I realize that these discounts help really fund those rural healthcare centers in these areas. And I've been in the boat as a small business owner where I've seen how third-party programs have constantly cut reimbursements. So my pharmacy was no longer viable as it once had been. Probably 6 years before I ended up selling it, it was a very vibrant type of practice. But as we've seen different reimbursements to actually healthcare providers seem to have been in decline, I realized that if the centers were to lose that revenue, which was significant, instantly I would realize that they would probably close those pharmacies that they own themselves because without the discounts, they wouldn't be profitable. I've spoken with enough colleagues of mine in rural areas that own pharmacies. I know that they would probably go underwater if the 340B program was taken care. So those patients in those rural areas would no longer have access to pharmacy. And in speaking with some of those directors in the community healthcare center, even I think there was an article that Senator Kane talked about. He went all over the state of Virginia, met with some of these directors, and they talked about how valuable it was to maintain that 340B program. I realized that this program went away, or the revenue that program brought in, quite likely some of those rural healthcare centers would have to close. In meeting with some of your association members, they've confirmed that belief to me. So that's a real lose-lose for the Commonwealth of Virginia. Like in my area, if we were to lose our pharmacy and lose the Stony Creek Community Health Center, the next nearest place people would be 20 miles away. There's no mass transportation to help get these people here. Most rural areas are economically depressed, so they can't afford transportation to get there. In these areas, a rural health center can have an amazing impact because they really don't have the resources there. What little resources they can in healthcare can make a tremendous impact. That's the real reason why I fought for House Bill 1162.
Yeah. And, I think that's important, listeners. And that's part of the reason why we chose to do a show like this, Otto, was because we really felt that many parts of our country and Virginia included, we don't ever really hear about, right? And you really hit the nail on the head that, in rural America, there are limited resources, healthcare resources. And when you do have a community health center sitting right smack in the middle of an area where you have to travel 20 or more miles to get to your healthcare provider, it's hard for some people to understand that concept, right? And I even want to say that about pharmacy services. So listeners, for those of you who have no problem walking down the street to go to your local pharmacy to get your medications, I just want you to think about if you were to live in rural America where, say, Otto, where he had his pharmacy, right? And there's no CVS or another big pharmacy near, and you only have that one small mom and pop, I'll just say for sake of explaining pharmacy, like what Otto owned. If he hadn't have sold that pharmacy to a community health center, there would not have probably been a pharmacy. Otto would have had to make the difficult decision to potentially shut it down. So, and that's why it was very important, Otto, that we had a show like this so that people can hear from parts of the world, of really parts of our country that you don't really hear from. So I really thank you for explaining that. And Otto, what I would like for you to just touch on real briefly, if you can, you spoke about some of those mom and pop pharmacies. Why is it so difficult for them to keep their doors open if they didn't have those contracts with 340B entities like community health centers?
Well, like I said earlier, about 6 years before I sold mine, it was a very vibrant. It was quite a rewarding practice. There was enough coming in, not only that my wife and I could raise our 2 kids and have a comfortable life, but there was some money there that we could reinvest back into the pharmacy. We are, because we're in such a low economic area too, a lot of times we would let people slide a little bit on what the price of their drugs were because we knew they couldn't afford those drugs. But every year when we would get contracts at the pharmacy level, every year we would get cut 1 or 2% on our reimbursements. Some people may have heard about with Medicare, they've got this thing called DIR fees, which stands for direct, indirect reimbursements, which I don't know anybody that can really make sense out of that terminology. But basically, months after the pharmacy has gotten payment for those prescriptions through this fairly complicated, complex, convoluted process, those Medicare Part D plans will score you on your efficiency. And they're things that quite honestly are beyond that pharmacy owner's ability to control. One is about 18 different plans. Each one has a different step. I don't know how you can possibly develop a plan that meets the needs of all 18. Usually one plan may want more 90-day prescriptions, where another plan may not let you do 90-day prescriptions. It's very difficult to work 2 things that are opposed to each other in your workflow. And when you're constantly every year getting hit with reimbursement decreases, it makes it financially impossible to stay in effect. And these DIR fees we get hit with, some of those are like 8-9% of the total amount you got reimbursed for prescriptions 6 months previously. Mm-hmm. I don't know how you can possibly have a viable model when you sell something and not know what you've actually sold it for. And likely when we buy things from our wholesaler, and the discounts that we get are dependent upon how much we buy that month. And it also depends on the spread between how much percentage we bought generics versus brand. And that's impossible for us to control because it depends on the prescriptions that are brought in. It's very difficult. In my county alone, we used to have 4 pharmacies in the 4 towns. When I sold mine to the health center in Stony Creek, I was the only one left. Mm-hmm. Since then, another one has reopened, but that one's also owned by a federally healthcare center as well, too. Without that 340B program that makes it viable for those centers to open these pharmacies, our entire county would not have a pharmacy.
Mm. Oh, my gosh. And what would an individual do about their medications if there's no pharmacy in the community?
Someone would have to find transportation 20 miles away each way. Some would go without. A lot of times they end up going to mail order, which is something that's an interesting phenomenon as the industry has vertically integrated, where different insurance plans also own their own pharmacies. They've done things to hurt pharmacies like mine by having preferential copays, where if you get it through the mail order pharmacy, there may be no copay. If you get it through the chain pharmacy that health plan owns, it may be $10. Or if you get it from Otto, it may be $30. That was extremely difficult for me. Not only did it steer a lot of my patients away, but it put me in a really bad spot of in the community looking like I felt that something I did was worth more money for that prescription. They felt like I was getting an extra $30 or $20 for that prescription, when that's not the case at all. In actuality, the insurance company just paid us $20 or $30 less than they paid themselves. So we were actually, in a way, funding our competitor to have our patients go to them. And it's very problematic. And when you're somebody like me in a community area that really doesn't help benefit the healthcare of the people there, and you're put in that position where all of your great intentions, it looks to the public like you're trying to cheat them out of something. The financial stress was certainly there owning a pharmacy, but that emotional stress is absolutely crippling.
And it's interesting that you share that dynamic as far as owning a pharmacy, a community pharmacy. There's been so much attention around this 340B program, and community health centers have been the victim, I have to say, of all the negative attention that's been occurring. And what people forget is, as far as community health centers are concerned, and I think because I'm biased, Otto, I'm glad that you made the decision to sell your pharmacy to that community health center. Because again, part of the reason why that community health center probably could entertain the idea of acquiring your pharmacy was because they were a 340 deemed entity, and they could use some of the savings that they realized through that program to help make that acquisition. Again, if they did not purchase it, like you had said, that community would be in a really difficult situation as far as being able to supply drugs to their patients. But I say that to say that, audience listeners, please know that when you hear about the dollars that go in and out of this 340B program, as far as community health centers are concerned, community health centers are required to reinvest back into the community health center as it pertains to ensuring that they can continue to provide healthcare services to your community. So again, the example is when Stony Creek Community Health Center made the decision to acquire the pharmacy from Otto. That was not to enrich their pockets. That was to ensure that pharmacy would still be able to provide medications to the community. And so the 340B program is a benefit to the community health centers in that we can continue to provide the level of services and the expertise that we need to be able to provide healthcare services. And Otto, I want to ask you, in your opinion, how can communities partner with mom and pop pharmacies like yours or community health centers as a way to continue to show their level of support for the 340B program for community health centers specifically? What is it that the communities can do to help show their support, in your opinion?
Well, before I get to that, though, I would like to say that, your assessment about Stony Creek Community Health Center buying the pharmacy to keep those pharmacy services there is absolutely right on target from my standpoint. Like I said, I started working in that store. I'm 59 now. I worked there 50 years because I started when I was so young. But that was my biggest concern, too. I wanted that store to be there to serve those patients that we had for so long in that community so they wouldn't have to make that 40-mile round trip to Petersburg or Emporia back. And I'm so glad that they did take it over. I did work for them for about a year and a half after the sale. So I'm very supportive of them, and not only for my patients, but a lot of my employees are still there. That was something that was very important to my wife and I. But, what can the community do to help support those community health centers? Hopefully they'll support them by being their patients to go there so that they can be seen. That's very vibrant. I think that is most important. That's what helps keep those centers there. And I can't imagine another reason why those centers would be there if that was not the case.
Yeah.
That is the biggest thing that I can think of. Certainly elected officials, I think it would be great if there would be a communication between those centers and the elected officials, invite them to come in. I know that's been very hard with COVID, but certainly now that is easing up. And it should be either the legislature contact them, or possibly, some of those directors can contact their local legislators to say, hey, can you come in and we can meet and sit down? That's the way that they learn. This whole process is extremely complex and complicated. I'd like to applaud your group for going around the halls in the General Assembly and getting this bill passed. I was concerned about 1162 because it's very specific. It takes an outside knowledge to understand it. And y'all did a great job of helping us shepherd that through to get it through. I think it went through unanimously in the Senate. It was 96-3 in the House.
Yeah.
So I think and I'm so happy that Governor Youngkin signed it. They realized that they need to do all they can help with healthcare in the rural parts of Virginia.
Yeah. Concur, totally concur. So, Otto, I want to end by saying, I just have one more question. Like I said, you've had an interesting path, and now you're serving us, Virginians, by serving in the House of Delegates here. What would you say to these young folks that are listening to our program, who are trying to decide? They want to get into healthcare, but they're not quite sure which way to go. And you're a pharmacist by training, and now you're working in public service. What would you say to some of these young kids about trying to decide which way to go and getting into healthcare or pharmacy and all that?
That's a very difficult question for me to ask, so much so because for the past 5 years, when I saw what happened to the business that I was so proud of, just the way the marketplace is, I've often would question to myself, would I do it all over again? And if I could get the first 30 years out of the career like I did, yes, I would. It was amazing opportunities. I really enjoyed helping people. Now it's a little bit different. You have to be a little more careful. I think the traditional side that you want to go into may not quite be there like it used to be. But having said that, certainly there is a tremendous amount of people out there that want nursing. Some of the chains in pharmacy have actually started trying to bring some of the pharmacists back again. Unfortunately, it seems like that industry for the past 5 to 6 years, when we had an abundance of pharmacists, sort of took advantage of them. And if you talk to any pharmacists in the big chains, they'll tell you about metrics and numbers. And hopefully we've gotten past that now. And the employers will see the benefit of that patient relationship that they used to have, which when we started losing that because of the numbers, that was something that concerned me quite desperately. But in the legislature, they realized that we need to do all we can to bring new healthcare providers in. I think the healthcare providers for the last 2 years that went through the pandemic and showed up for work every day, while they were aware subconsciously that a lot of the rest of the workforce was getting paid to either work from home or maybe getting paid not to work at all. That has placed an awful lot of stress on healthcare workers. If you're a nurse in a hospital, you can't do that from home. they were seeing all the negative sides of COVID. And now, unfortunately, we're seeing a lot of healthcare people that have been burnt out and are retiring early or leaving the healthcare workforce. Even some of the physicians that may have been criticized for treating their patients with unapproved treatments, whether that was right or wrong, that certainly was very stressful for those prescribers that were trying to do what they felt was in the best interest for those patients. It's been an interesting time for healthcare.
Mm-hmm. And then would you say for the young folks, although there are some really deep challenges in the healthcare field, what would you say to some of these kids who are considering on getting into healthcare, sir, that we need them, continue to persevere? What would you say to them? What would be your guiding
We definitely need, I think that we definitely need them. A neat thing to do is, get to some of the rural areas, talk to some of those people, see if they need them. They, in a rural area, you don't necessarily have the volume of patients that you need to look at elsewhere. So a lot of people, when they get that area, they tend to enjoy it more. There are a lot of opportunities there.
Yep, I would agree. We actually had on our one of our episodes a physician that came out of one of our rural areas here in Virginia, and she spoke about why she chose rural as opposed to going into a big urban city, right?
Yeah.
And part of it is what you had just shared, is that there are things that she's able to do that she probably wouldn't have been able to do if she were sitting in a big urban area. So yes, totally agree with you on that. Otto, what can I say? As always, you delivered such a great interview. And it was really important when I had talked to our folks here, our producer, that I really wanted to get you on our show. I'm sure the audience, our listeners, would concur as to why I felt it was important that we brought you on. So I thank you for taking the time. As always, I think I'm always saying thank you to you, Otto. Again, you're just such a big proponent of community health. And I just want to say thank you again. And I have your phone number, so I know where to call you when I need you next time. But thank you so much for coming on the program. And listeners, this episode will be available to you very soon. Otto, thank you. And with that, we will check you next time, listeners.
All right. Thank you. And I do look forward to seeing you in the Journalist Summit very soon.
I want to thank my guests for joining us today. And thank you to all the listeners for tuning in to Common Health, brought to you by the Virginia Community Healthcare Association. If you enjoyed this episode and you'd like to help support Common Health, I encourage you to hit the subscribe button, share it with others on social media, leave a rating and review, or visit our website at www.vcha.org. This is Tracy Douglas. Thanks again, and I'll see you next time.